the organization is changing for the positive. In fact, one of the things that I see is changing is my role, particularly, was a new role at WCCF, something that WCCF hadn't done in the past. And so for me, doing the community outreach, being able to reach out into the community and have the voices of those community members at the table, I think is very important. And so I think looking at it from that perspective is very good. I think WCCF is also taking a look at how we appear in the community from basically our name in terms of who we are, and who's looking at who's represented and who's not at the table with us. I think it's also an important role for WCCF, specifically in the work that we're doing.
I'm able to really reach out with the support of WCCF to the residents in my community. I'm able to bring them resources. I'm able to hold events. Bring my community opportunities where it's a lot of resources out here, but only until you are deeply in dire need for help will you find it. But I bring it to them firsthand.
You know, by any reasonable standard, Wisconsin is a wonderful place. It's a prosperous, caring, beautiful, thoughtful state. But I was worried that that big picture that we all share was obscuring the fact that there were hundreds of thousands of families in this state that were on the sidelines of our prosperity. There were families, many families with too little money, too little employment security, too little support to do what they wanted to do by their kids, and that as a result there were kids in this state, more than hundreds of thousands, who had bad odds to be successful when they entered kindergarten, who had bad odds of doing well throughout their school career, who had bad odds of graduating and going on to a successful career as adults. In simplest terms, who had bad odds of fulfilling their potential and becoming who they deserved and wanted to be.
Policy. Sometimes lawmakers don't know. We work on a lot of issues from 35,000 feet, basically. It is really the policy specialists, the groups that devote their focus to analyzing issues, to doing the research, that is so helpful to lawmakers, because that's not what we do typically. We are not specialists. We don't have, whole research entities behind us. So it's very, very helpful for us to have a group like the council out there who are experts in the impact of a particular policy, but also promoting policies and promoting issues that assist our kids, that give every child an opportunity.
All these issues are so tied together in the fabric of our community that we need to really be working on all of them at once. So I think that's a piece of the dilemma in the work, is we've got to be working systemically, and yet we know it's so hard to do that. Issues get presented one by one. So how do you work effectively on something knowing the implications of that, win or lose, affect in a domino way 3 or 4 other things. So I think that the complexity of our work is a huge issue to be able to help children and families.
So there's being able to think about the bigger frame, about the health of populations, about policies and programs, and not just about the patients in front of me is really important. There's actually a wonderful comic strip out there that talks about about Bruce Wayne, Batman, and how he tries to fix the problems in Gotham City by going around and punching individual muggers. Well, in healthcare, that's what I'm doing in clinic. I'm punching out individual muggers. I'm taking care of that ear infection, that cold, that attention deficit disorder, the child abuse. And you know what? That's really important. It's important for the people who are sitting right across from me, in front of me, in my exam rooms. But the thing is, I'm not going to solve many of the underlying problems that lead to these issues unless I think about a population frame, a prevention frame, and a public health frame. And that's where we need to do advocacy. Because if I see 6 kids come in who are all having asthma flares that are really quite severe, well, if I discover that they all live in the same apartment building, and that apartment building has a mold infestation, well, the solution isn't to give them more steroids. The solution is to get the landlord to clean up the mold.
WCCF is definitely moving towards centering racial equity. And I think that that's particularly important because all of the things that we work on need to be rooted in centering and focusing on communities that have been left behind in a lot of the progress that has been made. And if we're really going to move forward all together, we need to be intentional about focusing on those communities.
And in my opinion, I don't think that creating well-being, creating equity for all, even for our white, allies, this is about equity for all. When we all are doing well, we're all doing well.
Now is the perfect time for the Wisconsin Council on Children and Families to move forward and make some big and bold changes, and let the rest of the state know that the most important thing to be working on is making Wisconsin a more fair place for every child, every family, and every community. I think we need to do a better job of being advocates for those in rural parts of our state, for children on reservations, for our biggest cities. And I think that this change will help us do that. It will help us, give us the opportunity to communicate different, to kind of look at ourselves and make some changes internally, and really be the best advocates that we could be for every child, every family, and every community in Wisconsin. I don't know. I should keep going.
I think that was a good.
Okay.
Yeah.
Yeah.
And